Every minute an ischemic stroke strikes, your brain loses over 2 million neurons, aging more than 3.5 years in just 1 hour. This isn't just a medical number. It's your memories, your ability to speak, the names of your loved ones, all silently burning away, 1 minute at a time. My perspective is this. Brain cells are incredibly special. They help us think, learn, and remember. But that's also their weakness. Once a brain cell dies, it rarely comes back. It's not like a cut on your skin that heals on its own. That means every second you delay when stroke symptoms appear, you're allowing irreversible damage to happen. You're watching yourself slip away, memory by memory, moment by moment. And this is what makes stroke one of the most dangerous enemies we face. It doesn't wait. Just one moment of hesitation when your speech slurs, your vision blurs, or your balance wavers, and the damage might already be permanent. If you or someone you love lives with high blood pressure, chronic inflammation, or has experienced a TIA, please don't brush it off, because even a 1-minute delay could cost a lifetime.
Truth number 1. Stroke devours your brain faster than you can imagine. Every single minute an ischemic stroke goes untreated, your brain loses roughly 2 million neurons. To put that in perspective, that's like your brain aging 3.5 years every single hour. This isn't just some dry medical statistic. Picture this. It's like a wildfire raging inside your head, and every brain cell torched is a memory, a skill, a vital piece of who you are. But here's the deep dive most miss. Why is our body so damn helpless against this onslaught? My take is this. Brain cells are incredible, right? They let us think, learn, remember. They're top tier. But that very sophistication is their Achilles heel. Once a brain cell dies, it's pretty much gone for good. They don't just regenerate like your skin healing after a cut. What this means is terrifyingly simple. Delaying action at the first hint of a stroke means you're literally letting catastrophic, irreversible damage happen to your brain. You're allowing the core of who you are, your most precious and irreplaceable memories, to be wiped out. Truth number 2. TIA, why 99% of people drop their guard. So many people experience fleeting symptoms like a weak arm or slurred speech. It passes, and they breathe a sigh of relief, thinking, "Whew, dodged a bullet." This is a fatal trap of complacency when facing what's called a transient ischemic attack, or TIA. Here's the brutal reality. A TIA jacks up your risk of a full-blown stroke by up to 10 times within the next week, with the highest danger lurking in the first 48 hours. A TIA isn't a mini-stroke you just walk off. It's a crack in the dam, signaling a catastrophic failure waiting to happen. So why do so many blow off these warning signs? Ignorance about TIAs is literally causing people to gamble with their lives.
Before we continue, I want you to hear this story. Arthur, 68, was a retired history teacher in suburban Dallas, Texas. He lived a quiet life with his wife, Ellen. Every morning, he'd read the paper and walk his dog, Lucky, a routine they'd kept for over 20 years. One Tuesday morning, while flipping to the sports section, Arthur suddenly felt weakness in his right hand. The words on the page blurred and twisted. It lasted less than a minute. Then everything returned to normal. When Ellen brought him his coffee, she noticed something was off. "Are you okay? You look a little different." Arthur smiled, trying to shrug it off. "Just didn't sleep well. My hand felt a little funny, that's all." Ellen pressed gently. "Should we call the doctor, just to be safe?" He waved her off. "No need. I'm fine. Just need a bit of rest." They didn't call 911. They didn't go to the hospital. Arthur thought he had dodged a bullet. But what he didn't know was that he had just ignored one of the most urgent warnings the brain can give, a TIA. 2 days later, Arthur collapsed in the kitchen. A massive ischemic stroke. He arrived at the hospital unable to speak, paralyzed on his right side. And the doctors confirmed, if he had come in sooner, things could have been different. Later, with tears in her eyes, Ellen said, "I wish I had pushed him harder to call the doctor. Just one phone call. Now, he doesn't even remember our grandson's name."
Truth number 4. Stroke wrecks your mind and spirit.
At least 1/3 of stroke survivors battle depression. Many others grapple with severe cognitive decline, think memory loss, crippling confusion, or even permanent devastating personality changes. Why do these internal injuries happen, and why are they so damn dangerous? Depression can stem from direct damage to the brain's emotion control centers, or from the sheer catastrophic life changes after a stroke. It severely hampers their recovery. Cognitive decline hits when a stroke damages blood vessels feeding critical brain regions for memory and thinking. Survivors can struggle with the most basic daily tasks. Personality shifts, like becoming irritable or apathetic, often result from damage to the frontal lobe. The insidious danger of these invisible problems is that they often go unrecognized and unaddressed. Patients and their families endure prolonged suffering. It hinders their reintegration into life, and it flat out increases the risk of worse outcomes. So what's the takeaway here? If you're caring for a loved one post-stroke, pay extreme attention to even the slightest changes in their emotions, behavior, or thinking. Don't just brush it off as old age or they're just tired. Seek professional help. Understanding these injuries properly helps us empathize and better support them in their silent internal battle. This psychological toll is terrifying, but there's another danger, one stemming from our own well-intentioned but wrong actions when we suspect someone is having a stroke. The final truth will make this crystal clear. Truth number 5. Botched first aid at home, killing precious time and making things worse. Burn this into your brain. Trying to give someone showing stroke signs any medication, yes, even aspirin, or resorting to folk remedies like coining, pricking fingers, or moving them improperly are all dead wrong and can make the situation catastrophically worse. Why is this so damn dangerous? Giving medication without knowing the type of stroke can cause a massive brain bleed if it's a hemorrhagic stroke, or cause choking if they can't swallow. Coining or pricking fingers? Absolutely no scientific basis. They only waste time and can cause infections. Moving them improperly can worsen their condition. But the biggest danger of all these actions is that they waste golden time. Every minute that ticks by, brain cells are dying. Any delay crushes their chances of recovery. So what's the right move? When you suspect a stroke, the only and most critical thing to do is stay calm. Help the person lie down, preferably with their head slightly elevated and turned to the side. Loosen any tight clothing and call 911 or your local emergency number immediately. While waiting, note the time the symptoms started and absolutely do not give them anything to eat or drink.
Let me share a story that still sends a chill down my spine, a real-life echo of these very truths we've discussed. I remember a gentleman, let's call him Arthur, a vibrant man in his late 60s, a retired history teacher who loved a good debate and a long walk with his dog. One Tuesday morning, while reading his newspaper, his right hand suddenly felt weak and the words on the page swam before his eyes. It lasted maybe a minute, then vanished. Arthur, being a stoic sort, brushed it off. Just a bit tired, he told his wife. He'd dodged a bullet, he thought. That right there was the fatal trap of complacency we talked about with TIAs. Truth number 2 in action. He didn't know his brain was essentially sounding a fire alarm. 2 days later, the wildfire, as we discussed in truth number 1, truly erupted, a massive ischemic stroke. By the time he reached us, precious hours and millions of irreplaceable brain cells had been lost. The vibrant debater was struggling to form words, his dominant right side paralyzed. His wife later told me, with tears in her eyes, that she'd noticed his blood pressure readings had been a bit high on their home monitor for months, but they'd never really discussed it seriously with his doctor, figuring it wasn't causing him any problems. The silent assassin of high blood pressure, truth number 3, had been at work, undetected and unchecked. The aftermath was a stark illustration of truth number 4. Arthur, once so full of life, sank into a deep depression. His memory, once so sharp with historical facts, became foggy. His family, though loving, struggled to understand the profound personality shifts. They saw the physical recovery, the slow progress in physiotherapy, but the invisible wounds, the ones that wrecked his mind and spirit, were harder to grasp, harder to heal. They hadn't realized the immense psychological toll a stroke can take, or how crucial early, specialized support for these internal injuries truly is. Arthur's story isn't unique, unfortunately.
It's a tapestry woven from these dangerous truths, a stark reminder of what's at stake when we don't understand the full, often silent and devastating nature of stroke. It underscores why knowing these hidden dangers and acting on that knowledge isn't just important, it's a matter of preserving the very essence of who we are.